Been a lot of talk about antibodies in this pandemic. Using antibodies to fight a virus is not new science. It's how we naturally fight infection. The body develops antibodies that recognize the virus and attack it. Doctors use it as therapy to fight HIV, hepatitis, Zika virus, and now SARS-CoV-2. But to harness antibodies for therapy, doctors need to know how much and what type of antibodies are most effective.
Right now we're trying to help people that are dying and extremely sick.
That's the goal when it comes to treating severely ill COVID-19 patients with convalescent plasma, blood donated by those already recovered that contains antibodies.
It's both the quantity and the specificity, meaning it's not just the total concentration or total level of antibodies, but it's the right antibodies.
Scientists believe SARS-CoV-2 invades the lungs when a protein on those now famous spikes interacts with ACE2 receptors found on the surface of healthy pulmonary cells. Once inside, the virus replicates and causes damage. That process indicates the most effective antibodies are likely ones that target those protein spikes and neutralize the virus from invading a cell.
In fact, those antibodies are a minority of the antibodies that are formed in people.
Instead, researchers are finding higher concentrations of antibodies that target proteins on the inside of the viral particle, called nuclear antibodies. But in those who suffered more severe illness, they had better antibodies, the neutralizing antibodies that target the spikes.
What is being observed both in our studies, but has also been reported in the literature, both from China and now from the U.S., is that people who have more severe illness and then recover, they develop and have, in the recovery phase, in the convalescent phase, they have higher levels of neutralizing antibodies than in people who have very mild disease.
The end game, a more effective and nuanced therapy, harnessing the more powerful antibodies.
We don't have the understanding as to how to select or induce antibodies in those donors to be the most therapeutically beneficial. That's going to take us, many months, even years, to understand how to make the most effective convalescent plasma or immunoglobulin therapy. So we'll go from an early stage, which is where we're at now, where we'll essentially take plasma from any recovered person that meets some minimal level of antibody levels.
Surprisingly, even though this virus is so new, SARS-CoV-2 antibodies are already in our blood supply. Vitalant screens 25,000 donations a day through its network.
We do pick up blood donors that do have antibodies against SARS-CoV-2, but the levels of those antibodies, both on the binding assays and the neutralizing assays, are significantly lower than those that we're seeing in samples from patients who are coming back after they developed severe illness.
Dr. Bush says right now patients receive convalescent plasma from a single donor, but down the road he believes a pooled plasma will be administered, meaning a collection of blended plasma from multiple donors, combined to be a more potent and effective therapy.